So at this time, the doctor tells Howard, go ahead and take her to the ER here in Nashville. We'll get her admitted to make sure that it hasn't spread, or anything like that. And could help me control my pain. Over the phone, I was able to get them to prescribe fentanyl. They sent me a fentanyl patch. It was amazing because it was the only thing that helped. So we did that, and I headed straight to Vanderbilt. Got admitted, and waited for the team to come in and get me ready for surgery because it was that week. I wasn't scared. I had faith. Faith's what got me through. So I really wanted to step back there for a minute because I didn't, in the last few videos, I never even told that story of how much pain, because I thought, well, this is going to be really easy. What I didn't know. The pain was terrible. But they got that under control. I got checked in. We got ready for surgery. Okay, so, directly after surgery, the next day, no matter what you do, they want you up. Get you up out of bed. So, here I am on my little walk down the hall with my nurse. One of the nurses she came in and helped me pull up my hair. And look, there's the swelling. This is the point where they were coming in and doing the baby monitor on my mouth, checking to make sure that the vein and the skin was staying alive, because they redid my whole palate. Now here's a picture of my skull. This is a picture of my skull. And here on the right side you can see, look how thin that bone is. Oh, it's thin. And then they took out the right jawbone right here. You can see where they've taken out the bone all right in this area. So to keep me from, and I lost my septum. They took out the septum. They pulled out, of course I lost all those teeth right here, and they pulled out some of the teeth here, besides the one that just popped out before I found out I had cancer. But yeah, that's a picture of my skull. Here is a picture of my palate. And this is, you can see how dry. I stay so dry, but you can see how here it's just really, really dry. But look, this is the new palette that I have right here. Or that would just be a hole. It really is that's half of my palette, really, right there. That just had to be taken out. It was eaten up with cancer. And so when I go to the doctor and get a checkup, it's really cool because they can take the camera and actually run the camera through my nose down into my head. And he does this to look, to make sure that I have no anything unusual growing you know, or just to make sure everything is looking clean and staying the way he wants it to look. So this is where you can go into my nose and look. This is actually up into my head through my nose, looking down at my throat. So I try to keep my nose really clean with the neti pot, the little squeeze bottle. I use it maybe 4, 5, 6 times a day. It all depends on the weather and stuff like that. Here is closer down into my like my throat, but it's just amazing how they can go into my head and see that. I don't know what that is. It's inside my head, but it don't look right. Here I am after they took out the feeding tube and my trach was healing. I'm just so happy. Here is, you can see all this, how swollen it is, but really big. It was like huge. This is a picture of the back of the, behind the ear where they started cutting me. They cut me from here to right here. So anyway, you know, oh, here's one. This is a bad picture of just my eye and how it looks sometimes. Ooh, look at that. I don't even look like the same person in that picture. It looks like something else. But that's my normal eye situation. But I have an amazing group of doctors. Vanderbilt, oh, I just can't thank the doctors enough. The ENT department at Vanderbilt is amazing. I had an amazing plastic surgeon. I was cut from here to here and laid open. And you know, you can't really tell that I've been cut on my face, but when they took the skin and they filled my face as much as they could with the skin so that I didn't sink in, but I still have a real sunk in right here, and then right here for some reason it's really sunk in. That's where I lost my hair from radiation. It's come back in pretty good. It come in really good, but it took it forever. So to get that, all that said, that I had felt like I had skipped, and it's just a process that it's unreal. I live every day like it's my last. I enjoy life. I don't worry. I have faith in God. God gets me through. There is so many times I can sit here for days on days and tell you some of the things He's done that would have never happened without Him. I just feel so blessed. I've been, one of the reasons that I have not been making a video is I've been depressed. The holidays are hard. I'm going to say this, and just because I need your prayers, and I want to tell you the whole story at another time, because it's when I lost my daughter. This May will be 2 years she's been gone. She was 2 weeks from being 21 years old, and she was my best friend. I'm missing her so bad. But I want to tell you her story at another time. I'm trying to get through this process, so. But right now, what I'm dealing with the seasons and the weather is I can't take something that will dry me up as far as Mucinex. Can't do that. I'm already dry enough that if I take Mucinex, oh, it's unreal. I would have to be like this. Thank you. I never get a break from the bottle. But you learn to deal with things when life changes. Like cancer changed my whole life. I can't eat, especially things that I love. Where now it's metastasized to my lung. I'm getting ready to start radiation. We're going to do radiation on the lungs because I have a few modules that's up high in the lung where it would cause me to have trouble breathing. So at this point, I've been getting a little winded when I really shouldn't. So my visit to Vanderbilt this past week was to do my regular scans. I go every 3 months and see my lung doctor. And she was just waiting really on me to say, okay, it's time to maybe look into something else. Because I'm having just a little trouble breathing, more than I want, and might as well get it started if I'm going to have to do something. So we are going to start radiation on my lungs. I need your prayers for this process. The way she's talking, it's going to be pretty simple. It'll be nothing like the radiation I had on my head. I lost so much. I lost my teeth. I lost my saliva, my taste, my smell. You can't even cook without taste and smell, and it's hard to do those kind of things. So that is the next thing we're going to do is radiation, and see if we can kick this thing in the butt. I have faith, and God will take care of me, and we'll see what happens from this point. But right now I'm just dealing with eye issues. The eye stays really runny. It has its days. It has its own mind. It does what it wants. And I deal with MRSA inside my head that comes in the ear, and that is one of the things I deal with on a daily basis, is when is the MRSA going to come back.